questions. I can confirm that overnight, at this point in time, we have no new local cases of COVID-19, which is good news. Obviously, we're still awaiting test results that will come in throughout the day. Today, 4 cases of COVID-19 have been reported. These are all related to return travellers from India, and they are all in hotel quarantine. They are 3 males, 2 in their 30s, 1 in his 50s and a female in her 30s, having all returned from overseas travel and hotel quarantine, and are in hotel quarantine. There's an additional case that's under investigation. This case and the other 4 confirmed cases in hotel quarantine all originate from flight MH125 that arrived from Kuala Lumpur into Perth on Saturday, 24 April. I've just been advised at this morning's emergency management team meeting that 78 of the 79 passengers on this flight had been in India recently. Our expectation is the number of positive cases from this group of people will grow and potentially grow significantly. We obviously have enormous sympathy for India at the moment. It's obviously a diabolical situation that is going on in India at the moment, but it does put extreme pressure on our systems here in Western Australia and indeed in other states. I'm advised that other states are going through exactly the same experience. Yesterday we had a total of 8,433 tests conducted at private and public COVID testing clinics. This brings our total testing numbers since Friday to 37,396 tests. Testing has dropped off since Sunday. I urge everyone to continue to get tested. If you're feeling unwell or you've been to any of the exposure sites, get tested. This is extremely important. For us to open up further on Saturday, we need to have continuing tests. We need to be confident. We need to make sure that anyone who's unwell or anyone who's been to the exposure sites gets themselves tested. It's very important for all of us and for the safety of our community. There have been additional exposure sites in Applecross added overnight. People should visit the website and familiarise themselves with the new locations and indeed the existing locations. I can report we have 368 close contacts of the 3 positive cases. 255 have tested negative so far. All are in self-quarantine and we're awaiting further test results. There are now 797 casual contacts with 417 negative test results produced so far from those casual contacts. Obviously the numbers grow, the numbers move because more people are identified. Since the start of the pandemic, we have now performed more than 1 million COVID-19 tests in WA. Of those, more than 140,000 were from regional WA. Over the lockdown period, we had around 4.4 million check-ins. This included the Friday as well, 4.4 million check-ins. We need to keep up our testing, our use of the Safe WA app and our COVID safe habits as much as possible. We'll get more results today. Obviously, we'll make them available as soon as we can from our testing across the community. Can I thank all West Australians for doing the right thing over the course of the last weekend and the lockdown period. I'm very appreciative that people wore masks, showed the right spirit. It's very, very good of people. Can also thank the police and the contact tracers who did a great job. The police had to put up various measures very quickly and had to enforce the rules in the cooperative and generally good-spirited way that they do. And our contact tracers have been working overtime, as indeed our testing clinics as well over this period. So I'd like to thank everyone who did that work.
Any of those returned travellers from India, have they been vaccinated, do you know?
I don't know the answer to that question, but I do know last week we agreed that if you were coming out of India, you would need to spend 3 days in another location, get tested in that other location before boarding a flight to Australia. Now, I don't know if that's occurring. But clearly we agreed back in, I think it was November of last year, maybe December, that anyone coming from overseas to Australia had to get a negative test before boarding the aircraft. Yet what we're finding is large numbers of people are arriving who are COVID positive. So clearly the system isn't working as intended. And the way we agreed the other week to try and help with that system was to ensure that anyone who left the very highly infected places, like India, went to another location, for instance Doha or Singapore or where it was, stayed 3 days there, got a test that confirmed that they were negative in that location before on-flying to Australia. Now, I don't know if that's working, and I don't know if it's even been implemented. We obviously have a problem with India. I think some of the tests that are being conducted in India either aren't accurate or aren't believable, and clearly that's causing some issues here.
Why are we still accepting overseas flights where people who originated in India can come into Australia? What needs to be done about India?
Well, I think the Commonwealth is looking at suspending flights out of India, which is a good thing for this period. And that's very sad, very difficult to say, because people in India, no doubt they're not very happy about being there, and it's obviously a risk for them. But it's also a big risk to our hotel quarantine system, and you can see the consequences when there's a problem, because we just had the consequence over the course of the last 3 days. However, if someone leaves India and gets on a flight in Singapore or Doha or London or wherever it might be back to Australia, that suspension of flights from India clearly doesn't apply to them. So that's why we need to ensure that the integrity of our testing regime, and that is people getting tested with verifiable and accurate tests in those other locations, is put in place.
So is it the countries that are failing that, or is it the airlines that are required to?
I'm sorry, Jacqueline?
Is it the countries that are having to prove the tests and vaccines, or is it the airlines having to?
No, it's the individuals. So the individuals have to get tested. They have to produce the certificate. So if there's inaccurate or tests that are a bit dodgy being produced, so people get on flights, well, that is clearly impinging the integrity of the system, and that's why I think we're suffering these problems.
Is it your belief those inaccurate or dodgy tests are occurring in the third countries, like Malaysia, Singapore, Doha, those sorts of places?
No, because I don't think it's being implemented as yet. So the agreement at National Cabinet was that before you leave, if you were to leave, say, India, you have to go somewhere else for 3 days and get a verifiable negative test before you board another flight to Australia. I don't know if that's been implemented, but clearly that was the agreement.
When was it agreed?
Whenever that was, the last meeting a week ago or so.
Do you have any idea about the financial cost of this lockdown?
It will be in the tens of millions, the impact to the economy. And we're analysing that. The initial estimate I got was around $70 million was the Treasury estimate of this. Obviously, if we went into a long-term lockdown, if we had community spread, the cost would be many, many billions and tens of thousands of jobs. So that was the choice we faced.
Is there any... CCI's been on radio this morning and Bradley Woods last night talking about the government coming up with some compensation other than the electricity rebate that you put in place last time. Is the government considering helping out with the bills?
I'm very sympathetic to retail, hospitality and other businesses that suffered losses over the course of the last 3 days. And we'll look at what can be done. But a scheme in which there's applications and people put in claims for tens of thousands of dollars, that would be very difficult to administer and very expensive, and then we'd have to tax the same businesses to pay for it. So there's no easy answers with this. The best answer is to get ourselves back on our feet and get back to work and get everywhere open as quickly and as normally as possible, as soon as possible.
But state governments always step up when you have something like a cyclone going through Kalbarri or fires in Mooraloo. Surely this is the same sort of emergency for some of those small businesses.
Yeah, we'll look at what we can do and what we can do to assist, and that's something that's ongoing. I just make the point that whatever we come up with, probably some people will say it wasn't enough. But the best thing we can do is get the economy back up as soon as possible. Just make the point also, our hospitality and retail sectors are going the strongest they have in history, the strongest growth in trade in history, in the history of Western Australia, in fact the strongest in the history of Australia. And our economy, as you saw from the report that came down from the Commonwealth Bank today, is leading the nation in 7 out of the 8 categories. So our economic activity is as strong as anywhere in the world and stronger than anywhere else in Australia. We just need to get our businesses back on their feet as soon as possible, and that depends upon the testing regime over the course of this week. So I just urge everyone, if you're sick, unwell, or you've been to one of the locations in question, get tested.
How many cases do we have in hotel quarantine now? And when was the last time this
Cases or people?
cases?
From memory, we have 2,250 people. Sorry, I might get Roger. There's 2,230 people in hotel quarantine, and it's about 30 cases.
Yeah, from memory. Yeah.
It's around 30 cases.
And that sounds like it's the highest it's been in quite some time.
Well, we take the most per capita of anywhere in Australia into hotel quarantine, and the numbers of infected people are growing simply because of what's occurring in India. So half the cases, at least now, probably significantly more, are coming out of one country.
Have you also already started to explain just why it hasn't spread any further than these 2 community cases? Is it just blind luck for a second time?
It's difficult to determine. I might get Roger to comment on that. It's difficult to determine, but you know, we obviously take steps that other places don't take. Other countries around the world just don't take any measures. You know, they have politicians out there saying it's a hoax. They have big rallies and community events and no one wears a mask. Obviously, we approach it in a very different way. And the fact that we approach it in such a cautious and precautionary way, I think has huge benefits.
I said this morning that IPL cricketers should not be prioritised for flights back into Australia. What are your thoughts on athletes going to Tokyo for the Olympics? Should Australians be going overseas to Tokyo?
I think the arrangement is that athletes go to the Olympics. Tokyo and Japan is obviously in a different position to Brazil or to India at this point in time. Were they to go, I think they're to be vaccinated, and obviously when they come back, they're to be put into to isolation or in quarantine. Sorry, it's obviously one of those very difficult and tricky issues. But clearly, there are some material differences between Japan as it currently stands and other countries around the world.
How many people, the 4 positive cases today, and indeed return travellers on MH125, how many of them are in the high-risk hotels, I think, which are the Nuclear?
None.
None?
None.
No, okay.
How many cases being investigated? Is that return traveller? Do you have any more information on that?
Well, Roger might be able to enlighten you, but you know, I think they're just examining the test results to confirm that he or she is positive. But as I said, 78 of the 79 people on that flight we believe emerged from India, so we expect there'll be further positives out of that flight in coming days.
There's some speculation that Cricket Australia will organise a charter flight, or could organise a charter flight to evacuate some of those remaining Australian cricketers back to Australia. Would that be acceptable?
Well, it's a matter for the Commonwealth Government as to what they do here. And that's why I keep saying to them, you know, you have purpose-built quarantine facilities that are in remote locations that have an airstrip sitting alongside of them, a big airstrip set up for large aircraft. So I just urge the Commonwealth Government to take action here and make sure they use the facilities that were made available for these purposes. I realise there's been an ongoing argument about this, but it's not a new argument. It's an argument that's been going on for the entirety of this year. When they first evacuated people out of Wuhan, which, you know, there's been a lot of water under the bridge since then, but when they first evacuated Australians out of China back in March and April of last year, they took them to Christmas Island and they put them in the quarantine facility there. which has an airstrip, it has a hospital, it has purpose-built buildings. Since that point in time, they've refused to do so. I just make that point that they have done it before. They have the capacity, should they wish to.
Queensland Premier has proposed building a purpose-built facility in Toowoomba. Has the WA government done any work or feasibility studies looking at building a similar purpose-built facility anywhere in Western Australia?
Well, we're going to look at those sorts of things, but I just make the point, why build a purpose-built facility when there are existing purpose-built facilities that are available and unused? As I said, there's Yonga Hill, there's Curtin Air Base, there's Christmas Island, there's various defence barracks all over Australia. They're sitting there.
One of those arguments against that, using Christmas Island or Curtin Air Base is that it's too far away from hospitals, so that there's risk to the actual people who would be quarantining there. How do you respond to that?
Well, there are hospitals and health facilities nearby, and we have the RFDS, which can get people to health facilities reasonably quickly, and it's used for people all over regional WA right now who have severe medical conditions. If we use these services and these hospitals for people in Western Australia at the moment who might have a severe medical condition of whatever type, I don't see why that isn't good enough for people who return to Australia.
Would you really be comfortable though having people from India quarantining in Curtin where there's a huge Indigenous population?
Yeah, it's a remote. Yeah, I don't know if you've ever been there. It's a remote base with a large airstrip. It was set up for these purposes.
Isn't that adding risk? I mean, that transporting someone to a hospital on a flight is a lot more involved than just an ambulance from, say...
They're highly experienced at it. I'll just make that point. They're highly experienced at it. RFDS is highly experienced at it. They've done it with seafarers out of Headland and Karratha on many occasions, and they know what they're doing.
So what about Rottnest Island then?
Well, I've answered the Rottnest Island question many times, but I'll take you through it again. We've used it for very low-risk people, so cruise ships that arrived, and I thought it was a great option. So the Vasco da Gama, you might recall, back in, I think it was April of last year, arrived with 700 people on board, and we used Rottnest. We cleared Rottnest and we used it for those purposes. The Vasco da Gama cohort was regarded as quite low risk. The issue with Rottnest is that we could use it in emergency, but for higher risk people, where you have basically 3 separate families would have to share a villa and a toilet, it's not as good. So in effect, for a villa, you might need to use it for 2 people. So it's got 6 beds, 2 people with a toilet. Then we have to set up specific security because it doesn't have fencing, it doesn't have those sorts of easy put in place security measures. So we could use it if we need to, but there are actually facilities that do have security, that do have purpose-built facilities, that do have an airport next to them. They're owned by the Commonwealth, but they're not using them.
Professor Wuramanthi says that the Commonwealth and the state leaders are on a war footing around vaccines, but not quarantine. Is he right?
I don't understand the question.
Professor Wuramanthi.
Yeah, I heard that, but what does he mean?
Has said that Commonwealth and state leaders are on a war footing to get vaccines out in terms of National Cabinet meeting, but there's no similar war footing mentality around quarantine and getting that right.
Well, quarantine has to be urgent. Fixing this is urgent. So I've written to the Commonwealth to halve our cap. We're going to work out what we can safely take, and we'll be reducing the numbers of people returning in through Perth so we can have a safe number of people that we can manage properly in the system as we currently have it. So that's why I'm suggesting to the Commonwealth they have facilities that are available that they could use.
Which military bases have you identified as being appropriate? Because some aren't. I mean, you probably wouldn't put them in Irwin Barracks or Lewin, but is it just Curtin or Christmas Island?
Okay, a couple of things there. They're all over Australia. So there's a range of them in Victoria. There's some in the Adelaide Hills. There's a range of them in the Territory, and Queensland obviously has large numbers. In Western Australia, we have Curtin Air Base. So Curtin Air Base, I saw them out there, the Commonwealth out there the other day saying, oh, it's an operational base. It's not an operational base. It's an airstrip. And it's used in emergencies. So if the country, God forbid, ever goes to war, it operationalises and you use it as a northern forward base. So it's a large airport that has virtually no one at it, but it has a large quarantine facility there that was built for asylum seekers. It can take up to 1,500 people. Then you go to Yonga Hill, which is near Northam, which is a large quarantine facility or facility set up largely for asylum seekers, but I think they call it a quarantine facility actually. And then you have Christmas Island, which is not a defence base, but was built for these sorts of purposes. So at present they have some people there who are awaiting deportation. I'd say to them they should probably speed that up. But it has accommodation there that could be used. So all those options are there. Look, it's regrettable. All this sort of disputation has taken place over the course of the last 3 or 4 or 5 days, and I'd like a cooperative approach. But the way it works at the moment is the Commonwealth just says that's state responsibility, even if the Constitution says it's theirs. And so we're going to push back, and we're only going to take what we can safely do.
Is it previously the centre full? And Christmas Island also has...
It has some people there. I don't know about Yonga Hill, but I do know that at Christmas Island there are some people there. And I think the argument has been, how could you put returning Australians in near, but not in the same, facility as people who are being deported. But frankly, to make all these things work requires a bit of work and, and flexibility and effort, not just pushing back and saying, no, can't do. There's solutions to these things if they wish to do so. I mean, they could clear Christmas Island of potential deportees and put them into another facility in Australia that is secure if they wanted to use Christmas Island. Just requires effort, that's all. We've done that. We've basically cleared 9 major city hotels. These are not small things. We set up whole security teams and cleaning staff and everyone else to keep the whole thing operational. We've done it. I don't see why the Commonwealth can't look at doing the same thing.
You said previously that the state stepped up when the federal government gave them responsibility for quarantine. Isn't it time now that the state just steps up on its own, builds its own facility, using some of its enormous surplus? Is that not? Is it time for the state to be the bigger man?
Look, they're the sorts of things you can look at, but to do something like that may well take years. And then at the end of COVID, it may well then sit there for no purpose. And if there's existing facilities that aren't being used, I would have thought that's a more sensible option.
Nonetheless, you did say the state government would investigate.
I will investigate.
Where do you see that being placed potentially, and would it be co-funded by the state?
That would be subject. That would be part of what we're currently looking at what we can do.
So that work has begun, and is it in consultation with the?
No, it's really in its early stages. Obviously, the events of last Friday have put a new focus on that. We'll do that sort of examination now.
So just to be clear, with the detention facilities that you mentioned, there's capacity to move people that are currently detainees. There's capacity to move them to different areas and free up one. Is that what you're saying? Or
well, of course they can. So they moved the deportees. So the deportees are often people who have a criminal record or who are currently subject to criminal conviction. They move them to Christmas Island. They can obviously move them back to whichever prison they're in, and they can move them into one of the secure facilities on the mainland if they wish to. It just requires flexibility. I mean, I can't solve all these things standing here before you today, but I think that they do need to use a bit more thought and a bit more flexibility and a bit more effort to assist in finding solutions to this problem.
And just for clarity, Premier, the National Security Committee meets today. Are you fully in support of them stopping all arrivals from India?
I don't know what's on their actual agenda, but I have said that India, there needs to be a suspension. And if they wish to come up with a new arrangement around India using Christmas Island or using some of the more remote facilities, that's a matter for them. But obviously, and I think every state's going through this, there's huge pressure now on all our quarantine facilities as a result of people coming from India. What makes it more galling, and I'm going to repeat it, is people have gone over there over the course of the last few months for weddings or funerals or to play sport or whatever other purpose, and I don't think that was necessary. And people returning who are COVID positive, having gone there recently, is a problem that we're all now facing.
The cricketers, though, had contracts to fulfil, although very lucrative contracts to fulfil. Do you think that they should have abrogated their responsibility to fulfil their contracts and not gone?
We're in the middle of a worldwide pandemic. India is the epicentre of death and destruction as we speak. And I don't think there was any need to go to India. I don't.
So specific to India, you don't have a problem with people going to weddings or funerals in countries where the coronavirus is not as...
No, I don't think people should be going overseas for weddings or funerals. I don't. Yeah, well, hold on. The Olympics in Tokyo might be an exceptional case, but I've heard of people going to athletics carnivals or cycling events and that sort of thing. Heard of people going overseas because they wanted to go and do some course at some, an undergraduate course at a university somewhere that is full of COVID. I just don't see the need. I mean, maybe I'm unusual, maybe I'm out of step, but I think it's just common sense that you don't leave Australia, which is essentially COVID-free, and go to a country full of COVID, then get sick and want to come home. Don't see the sense in it.
Should fans get used to the idea that they won't be going to the Derby on the weekend?
Oh, look, we'll work out the answers around the football and further measures as we step out of this phase, hopefully by Thursday or Friday, and we'll be able to provide advice to people at that point in time. As the Health Minister has said, we're very confident there'll be a football game. What the crowd levels will be, I'll be able to advise people later this week.
What about mark measures this time around are far less onerous than they were back in January? What does that tell us about how the government's approach to handling these sort of things has evolved? And does it also show that the January response was just over the top situation we were in?
No. We learn from both the experience here and in other states. So Melbourne's most recent lockdown was 5 days. Queensland's was 3 days. New South Wales did a whole range of lockdowns that went on over a considerable period of time, particularly around the northern beaches of Sydney, which is 500,000 people or so live there. Different states do different things, but it's broadly consistent. And, I know there's a lot of anger about lockdowns in some sections. There's a lot of anger, particularly in some of the media commentators in the East and some sections of the community. But the alternative, where you have the virus running rife and you have the situation like Britain, particularly when we don't have wide and large numbers of people being vaccinated, is unthinkable. The alternative is unthinkable. We don't have the vaccine rolled out. We have around 89,000 West Australians currently vaccinated. We have a lot of vaccine hesitancy. And so in that situation, if the virus gets a hold here, we'll have mass deaths. And so that's why we take the measures we do. Yeah, it's a workplace. It will return on Thursday. Obviously, we'll adopt the best measures we can, including mask wearing in Parliament, but it is a workplace, the same as other workplaces. You can't do it from home. I expect that members will be there. We'll have very limited visitors at Parliament, like we did last year. Members will be there. People have to be sworn in, but it's a workplace. And so under our rules, workplaces can return. Mask wearing will be required unless you're speaking, as I am now. I note the comments, why is he not wearing a mask? It's because when you're speaking like this, many people watch your lips to basically understand a lot of what you're saying. So that's why people like news reporters do on their news reports. They don't wear a mask so that communication can be clear.
The acting Victorian Premier has written to the Prime Minister he wants international students to be allowed to come back into Victoria. Do you think that's premature?
I don't know anything about that, but I'm not supporting that sort of arrangements at this point in time. I do know with students, the talk is that they put them in colleges, they bring them out of countries, they put them in colleges, and then they rely upon them doing the right thing. I was a student once. I know I didn't necessarily do the right thing at all points in time, and so I wouldn't be so trusting.
Can I clarify your understanding, just to go back to the slide, understanding of the 72-hour transit rule?
The 72 what?
72-hour transit rule for people coming out of India having to test negative again in the third country. Is your understanding that that is yet to be implemented, or what is your understanding of where that is at?
I don't know where it's at. I think that's a question for the Commonwealth. I don't know where it's at. That's the agreement, because the efficacy and the accuracy of the test results in some countries, in particular out of India, is questionable, and so therefore having that transit rule in place, I think, is a sensible and a great precaution. I'd urge the Commonwealth Government to put it in place immediately.
Will wastewater testing be amped up in suburbs?
I'll let Roger respond.
Back to the potential of using Perth and Base as a quarantine facility. The local Shire president has said that it would be too dangerous for local Indigenous people, and that they would only need one person to come into town and spread it, and it would be a huge problem. What do you say to that?
Well, I've been there, and it is reasonably remote, and we have to use facilities that were built for these purposes. Obviously, we've done everything we can to protect Aboriginal people across Western Australia, and we still have restrictions on anyone going into remote Aboriginal communities that currently exists, and that will continue.
And just on that, 207 detainees are on Christmas Island. They're immigration detainees. They're not prisoners. And people that are subject to
well, they are prisoners. They are prisoners. They're in a immigration facility awaiting deportation. But in any event, you know, the Commonwealth can manage those things. As I understand it, they moved some of them there recently. You might recall, I think they put a $1.5 billion upgrade into Christmas Island there a couple of years ago because there was an asylum seeker boat that was spotted. So they upgraded and spent a fortune on Christmas Island. So the facility's sitting there.
There are still Australians that remain in India. You know, for whatever reason they went there, they're still Australians, and you know, we still have to welcome to allow them to come back home. Given that flights are likely to be banned, do you support some kind of emergency flight or anything like? Because you know, the longer they remain in India, the more likely it is to be exposed to the virus, and the health systems there can't really cope with it at the moment. So we're putting them in harm's way by leaving them there.
Look, I support a suspension because it's putting at risk this country, and that's a hard thing to say. And Australians or permanent residents or others who want to come into Australia from India, it will be difficult for them. But I just repeat, many of the cases we're getting are people who went recently. I don't know why they did that. They didn't have to do that, but they did, and so that's a problem that was not of our making.
I mean, have you had your COVID test yet?
COVID test?
Vaccine, sorry.
No, I haven't. I think I become eligible on May 3. As soon as I can after that, I'll get my vaccination.
Have you been tested for COVID recently?
No.
Clive Palmer's defamation case against you will be heard today, I believe.
Is it?
I believe so. Have you made any efforts to settle that out of court in order to save taxpayers' money?
Look, his case has no merit, so paying Mr. Palmer money is not something we're going to be doing. But obviously, sure, the courts will either hear it or he'll withdraw from the case. He has a long history of taking these things to the brink of being heard and then withdrawing. So who knows what he'll do. Thank you.
Just on the front page of the Oz Today, Home Affairs Secretary Michael Pazullo said that the drums of war are beating when it comes to China and Taiwan. What do you make of those comments from such a high-ranking public figure?
I didn't see that story. I saw a tweet. Was he referring to Australia being involved in that?
Well, yeah, he's saying that we should be prepared to send our warriors to fight. So, yeah, he's suggesting that conflict is on the horizon.
Look, I just urge the Commonwealth and people in this position, elected and otherwise, to tone it down. Tone it down. What good does that do? saying things like that. It's totally unnecessary. It gets a headline. No doubt probably secures you some coverage around the world. And you know, there may be elements in the community who cheer, but it's in no one's interests, that sort of language. Diplomacy should be conducted diplomatically by people in elected office and also by those who are public servants. So I just suggest to them they don't say things like that anymore. Thank you.
Just before we start, Josh, to go to your question, we are currently managing 28 active cases.
And you know when the last time we had that many active cases was?
Not off the top of my head, but certainly all the health officials have observed that we are dealing with a big burden at the moment. And we clearly have to sort of keep an eye on where those positive cases are, just to make sure the viral load is maintained at a manageable level.
Is that,
It's possible that 78 people on that plane could test positive to COVID. So are there plans in place for how they will be quarantined? Will they be in the same hotel? Will floors around their rooms be cleared?
So every time there's a positive case, we essentially look at where that case has occurred in the hotel, and sit down with the hotel floor plans and work out what's the optimum way of managing that particular case. As your question implies, every time you have an active case, particularly of this many, that process becomes more challenging. Yeah.
Did all of the people on that flight go to a single hotel?
Yeah. So what we do on each flight, in order to minimise the risk associated with people movements, is take a bus load to a specific hotel. So they would all be in the same hotel. But as the Premier observed, over a number of weeks now, we are having flights with increasingly large numbers of positive cases, and so that's just the reality that we have to deal with.
And what hotel are they in? Sorry.
I don't have those details.
does the 28 active cases in hotel quarantine include the 2 locally transmitted cases, the 986 and the woman from the dental surgery?
984 and 986, that would be, yeah, my understanding, yes, because they are in hotel at the moment.
So why are they being held there where, you know, risk of transmission is greater? Could they not do that? Could they not quarantine at home?
Well, I think the idea was that the risk of transmission is actually reduced, because by having them in a hotel quarantine facility, we can manage those cases better. It's out of abundance of caution.
And that case that's under investigation, can you shed more light on that?
So every time we do run a series of tests, sometimes you'll come up with people who are weak positives. Now that may be that they're early in their particular infection period, so that therefore we need to sort of wait to see if they become more positive. Sometimes if they're a weak positive, they're people who have actually had the disease in the past, and serology testing then informs you whether they've developed antibodies and therefore whether they're actually a shedder as opposed to someone who's taking on the disease. So we're just going through to complete that investigation at the moment.
And that person's in hotel quarantine?
All these people are in hotel quarantine.
Will
Yeah.
wastewater testing be amped up in the suburbs of exposure sites?
Well, I've received a briefing on wastewater testing recently and gave those details to the media. The nature of wastewater testing is because you're dealing with such low presence of the disease, you don't actually get informed anymore by doing it on a more regular basis. I think the regime has 2 to 3 times a week, so because you actually need to wait that period of time for the samples to be able to be detectable. Obviously, in our Subiaco wastewater treatment facility, we have a higher presence of the disease because they're the ones that service our hotel quarantine facilities.
Do you know if non-infected guests are next door or across the hall from infected guests in any of the hotels at the moment?
That would be highly unlikely. What we do, as I said, when we have a positive case, is that we then sit down with the floor plans, understand where those cases are in relation to other guests. We tend to leave positive cases in situ, that is because to move them out of their rooms represents a risk, but we vacate to the best we can other negative guests around that room, and in addition to that, of course, move any quarantine staff, particularly security staff, away from that positive room.
And how restricted are you with that at the moment? Because yesterday, Andy Robertson said that, given how full the hotels are, they're kind of limited.
Yeah, that's right. So that's part of the challenge that they're faced with. But we continue to be able to manage that on, as Dr. Robinson said, on a case-by-case basis.
Are you able to tell us what the amount of the amount of running hotel quarantine throughout the pandemic has now cost WA taxpayers?
No, but I'm happy to provide those details, Jeff. Obviously, it's a very expensive exercise.
And the percentage, though, of people who come in and who just don't pay?
Well, obviously, we have some who do not, some who have their fees waived, and others ultimately who we have to pursue in the same way that you would any outstanding invoice. We do have those statistics. I'm happy to provide them. I just don't have them with me at the moment.
Okay, who gets their fees waived? I'm assuming these latest two community cases who are in hotel quarantine aren't having to pay.
Indeed. And obviously the Department of Communities takes a compassionate approach in relation to those who aren't in a position to pay, or for other reasons that might be considered legitimate.
There's a couple of reports that we're still chasing. I think the hotel air quality report, and also the one from the January 6th incident, or January 5th incident, whatever it was.
Yep.
You knew who, on the second one, the January 5th, you knew whose desk that was on a couple of days ago, and it wasn't
Yes.
yours. Where's that one for?
So the first of those reports is characterised as the ventilation report. That will be made public today. The incident report into the January situation has been received by my office. I'm getting a briefing on that today. I'm very happy to provide details on that as soon as I've had the opportunity to be briefed.
How do you explain to businesses that they can only have 20 people inside, but weddings and funerals 100? Can you shed any light around that thinking?
Look, what we wanted to make sure is that as we come out of this particular period of the lockdown, is that we put in place all those things which don't exacerbate any of the risk levels associated with the outbreak. In a hospitality environment, you obviously have a heightened level of risk associated with the number of people and the way they behave in those sort of facilities. With weddings and funerals, we understand that people have made commitments, or they are periods of particular there's grief, and obviously we want to be respectful of that process. So in relation to weddings and funerals, we've asked both the funeral directors and the people who are hosting the weddings to contact the department so that we can be satisfied they've put measures in place which do actually reduce the level of risk.
How do you apply for an exemption for a wedding?
You simply contact the 13 COVID line, and you'll put in touch with the Chief Health Officer's office.
Just to an earlier question, can the authorities start to explain why this hasn't spread, or is it blind luck for a second time?
Well, obviously the 3-day lockdown was an important pause. That enabled us to utilise those days to identify any close and casual contacts. In relation to the close contacts, they are isolated for 14 days. So the pause that the lockdown represented was an important opportunity for our contact tracing teams to make sure that we can identify any close contacts, isolate them, get them tested. So it's been a successful exercise. In all these situations, you are subject to the vagaries of a virus and the vagaries with which that virus makes its way in the community. We're not out of the woods yet, but we are making good progress, and today's zero number of positive cases in the community is obviously a very important signal that we are starting to get on top of this outbreak.
Last question. Thanks. Better go to Kevin.
Thank you.
Thanks.